be going through the basics of pharmacology, then also the classification of drugs. So see what we can do for these 20 presentations. So for the next classification of drugs that we'll be looking at the type of drugs that are known as a peripheral muscle relaxants. So when you say something is peripheral, it's just your normal muscles in the body. When they say peripheral muscles, you are mainly talking about the voluntary muscles. These are the muscles that you can control their action. Like my hand, if I want to close my fist, it closes. But the way my heart is beating, I can't control it. Okay, so have voluntary muscles, involuntary muscles. So we're talking about peripheral muscles. These are basically muscles that they are skeletal muscles, so you can control them. So peripheral muscle relaxants are also known as neuromuscular blockers. So these drugs, how they work is this: there's a neuron here, so they are communicating here. Okay, so if you bring a drug and you block this neuron from communicating with this other one, there's no impulses passing, so you paralyze that part of the body. Okay, so they're usually used in surgeries to just weaken the patient so that the patient will slip off, so that you do your surgeries and go out and all of that. So what's the classification of these peripheral muscular relaxants? First we have the depolarizing neuromuscular blockers. So examples of drugs include the acetylcholine. I think I actually had their pictures here. Yeah, this is acetylcholine. So when I uploaded, you guys to see the pictures. This is acetylcholine. How does acetylcholine work? It acts like acetylcholine, but it depolarizes the motor end plate. It causes too much vibration in a neuromuscular junction that the nerves will get weak. Do you understand? Overstimulation. When it comes in, overstimulate, then the muscle actually gets tapped out. So phases all those depolarizing block, fasciculation leads to flaccid paralysis. Then phase 2 we have the desensitization block. This one, the nerve is no longer responding to any impulse. So uses is basically for intubation. Maybe the patient is unconscious, so they want to relax their respiratory tract so that they can basically be able to put a nasogastric tube. All right. So adverse effects can cause hyperkalemia, malignant hyperthermia, bradycardia, increase intracranial pressure, increase ocular pressures. We're not saying those adverse effects must be there every time. So looking at the non-depolarizing neuromuscular blockers, we have drugs like the Rocuronium, we have the Vecuronium, a lot of them. We have the Rocuronium, a lot of them, right? So those are the amino steroid groups, the ones I listed. Then the benzyl isoquinoline groups. That's why you have drugs like the Atracurium. Their names are really crazy. Actually, they are not really drugs that you can always walk in the pharmacy and get. Okay, so these ones usually get them on request. So Atracurium, we have the cis Atracurium, we have the Vecuronium, we have the tubocurarine. Okay, so those ones, that one has been withdrawn. The drug has been withdrawn from the market. It's no longer being sold in the market. Their mechanism of action is those ones, they completely block receptors. Impulse coming from the pre-nerve to the post-nerve, it has to come and attach on the receptor so that the nerve will recognize it. But if the impulse is attaching on the receptor and the receptor is not accommodating it, automatically it's just as if there's no impulse. So for this one, for the non-depolarizing neuromuscular blockers, this is how they work. They basically block the receptor. So if you want to reverse the blockade, you can use drugs like the neostigmine, the hydrophonium, the sugammadex. We'll get to talk about all of them. So clinical uses, they are used for surgery, weakening the patient, paralysis, okay, seizure control. So if the patient is having all those jerks, you can just give them the drug, just weaken the whole body like that. So adverse effects, histamine release, cardiovascular effect, not really serious. So this is a picture of Rocuronium, and I think that was all for the peripheral muscle